On the campaign trail, President-elect Donald Trump said repeal and replace when it came to Obamacare. So for all of us, what does that mean about our mandatory health insurance that we all have to purchase? Craig Gussin from the San Diego Association of Health Underwriters is here to talk about it. Good morning.
Good morning.
Okay, so let's just start with the big one.
Okay.
Repeal and replace. That's what President-elect said.
Right.
So do I have to buy health insurance because he told me that they're going to repeal and replace it?
If it does happen, it's not going to happen for 12 to 18 months. It takes time to have it happen. On top of that, we're a state plan, not a federal plan. So for that reason, regardless of what happens in Washington, D.C., we're not going to see any change unless there's some kind of mandate that we have to, or they just get rid of the subsidy and they can't afford to stay as they are.
But and also I should probably point out that all of these health insurance carriers, didn't they already sign a year contract to make this happen?
They did. A lot of things aren't going to happen. I mean, again, if they do make changes, the insurance commissioner in California has to approve it. So it's not like you can just go on, on January 20th and say, okay, here's what we're doing. You're seeing articles every day about concern about changing things and what's going to be changed, what's not going to be changed. And the things we're hearing are that kids can stay on parents' plan to the 26th. There's going to be no more. There's going to continue to be no more lifetime, maximum. And on top of that, there's going to be no health questions. So it's, regardless of your health, you'll still be able to buy health insurance.
So, I mean, regardless,
right.
We're hearing that those things are going to stay.
Are going to stay. And that's the good part of it. What they got to do is they got to fix things that don't work, such as somebody who loses coverage during the year because they forgot to pay the premiums. They don't have coverage. We can't give them insurance until January.
Until the next year, right?
Right.
Also, we need to talk about, so before we get any further, I just want to make sure we're clear. Everybody has to go and buy health insurance.
Right. By December 15th, they get a January 1st effective date. If not, they're going to get a February 1st, and if they wait past January 15th, they're going to get a March 1st, which means you're going to pay a penalty for January and February, which is $695 a year. Or 2.5% of your income, whichever is higher.
Whichever's greater. Okay, so that's important to know. Also, let's talk, because one of the biggest problems with Covered California and Obamacare nationwide is that the premium, the premiums are costing more and more and more. This was supposed to be affordable for everyone. That was the whole point of getting everybody to force everybody to have health insurance. We were supposed to get cheaper premiums, but everything is increasing significantly.
It has gone up a lot. I have a client I just met with last week where they were paying like $1,200 a month. Their rates went up to $1,500 a month.
$1,500 a month?
Yes.
My
goodness. They were getting a subsidy from the government of $1,000 a month. So the actual cost was $200 a month, now going to $500. We met with them, looked at their plan, gave them some ideas, and got it down to back to $200 a month by changing plans.
Right.
Because that's a big deal, and rates are going up. If you look at every second or third advertisement you see on TV is for pharmacy. Pharmacies are one of the biggest costs of healthcare going up. And, again, I just saw your story about Sharp going on strike. The nurses, it's going to cost.
That's all part of this cost increase.
The whole picture, yeah.
Okay, so let's talk about deadlines and how much longer we have to sign up without incurring any kind of penalties.
Okay. December 15th, you have to sign up to get a January 1st effective date. If you sign up anytime after December 1st, you're probably not going to have your health insurance ID card by January 1st. So you want to sign up as soon as possible. If you need help, reach out to the San Diego Association of Health Underwriters. There's a link right there. It says find an agent, put in your zip code, they will help you.
And that's free of charge.
And it's free of charge. We get paid by the insurance companies just like the doctors and the hospitals do. But sign up as soon as possible. If you have a Scripps doctor and your rates have gone up a lot under Blue Shield, because they only use the Scripps network, HealthNet has an HMO plan that has a Scripps network. And that is a great way of going. Sharp has their own plan for the Sharp doctors. Another great way. Those rates have not gone up a lot, and that's what most people are going to.
Yeah, I do know by experience my own, because I was on Covered California before I started here. And you have to really look at those plans, and you can really shop around. I mean, I won't say that you can find a deal, but you can definitely shop around.
Right, and how big a deal is it to have your doctor? I'm having a lot of people say, I've had this doctor in the Scripps network for years. Maybe I'll look at Sharp. Maybe I'll look at Kaiser. And I always say, you know what, try it for a year.
And see.
If you don't like it, we can always move you back. But you are going to be stuck for that year.
Right.
The other option is also talk to your employer and see if they're willing to open up and have a conversation about maybe providing benefits through the job.
Yeah.
And we show them the tax advantages for the employer of doing it too.
All right, Craig, always good to see you. Thank you so much for your time.